Hi, I'm Dr. Nicky Keay. I'm a medical doctor with a particular interest, clinical and research in hormones, and I'm the author of Hormones, Health and Human Potential. I want to discuss the incidence of ACL injury, anterior cruciate ligament injury. There have been several cases of professional female athletes suffering this injury. And so I want to explore some of the reasons why this might be the case, that female athletes are far more likely to sustain this type of injury compared to their male counterparts, because it's really important to understand. If we can understand the reasons why, we can put in place appropriate preventative measures. So first of all, what is the ACL? This is a ligament, and it's in a cross structure inside the knee joint, and this stabilizes the knee joint and makes it less likely that you will injure yourself. However, in some sports, particularly sports where there's a rapid change in direction and of course contact sports, there is a risk that high loads might cause this ligament to rupture, to break. And this leaves the knee in a very unstable position. And for many professional athletes, and indeed amateurs, I myself also ruptured my ACL, and I did have to have this surgically repaired because trying to do, in my case, dance, ballet, my knee was far too, wasn't stable enough to perform this. So what are the facts, what are the evidence why women are more likely to sustain these types of injuries? We could look at external factors. For example, many of the training methods and indeed the equipment is based on the blueprint of a male athlete. So that already could be a risk factor for a woman participating in sport. The other obvious difference between men and women comes in terms of their hormones, internal factors, in other words, what we're talking about. And women, of course, have menstrual cycles. When there's a big fluctuation in the female ovarian hormones, for example, estradiol, most powerful form of estrogen, and progesterone, which occurs every menstrual cycle. We know that estradiol has an effect on soft tissues. It makes ligaments and indeed tendons, muscles more flexible, more pliable. And therefore, theoretically, there could be an increased risk in ACL injury when estrogen is at its highest level, and that is before ovulation. And indeed, there are some studies to show that this is indeed the case. There's an increased risk of, or there's an increased incidence of ACL injury occurring before ovulation. However, there are also studies which refute this finding, saying no, there wasn't a difference found in the phase of the menstrual cycle. So this is a little bit confusing, and I think most likely it comes down to the fact that every woman will have slightly subtle differences in terms of the timing of the fluctuations of her hormones during the menstrual cycle, the levels of the hormones produced, and crucially, above all, her own personal biological response to these hormones. For some women, it might make the ligaments very lax. For others, it might not. So where does this leave us? With a lot of work to do is the answer, to try and unravel the complexities of ACL injury occurring in female athletes. But everything points towards whatever the solution to mitigate this risk, it's got to be personalized, individual for the athlete. And this could take the form of prevention in terms of specific tailored neuromuscular skills for the athletes. And neuromuscular skills, in other words, strength training, activation of muscle groups to stabilize the knee joint as much as possible, so to try and reduce the risk of very challenging loads for the ACL injury. So I hope you found that of interest. Once again, pointing that female hormones are crucial to many of the discussions we have when it comes to health, performance, and indeed injury.